Hi everyone. So I got a question today about whether or not patients who have TMJ problems can they still have surgery to correct their class 2 or class 3 male occlusion. Um, Now, to answer this question, it really depends on what kind of joint problem you're having. So, of course, for long-term success for corrective jaw surgery will depend on a stable joint and a stable conda. So, it's very important that you have a good foundation to your to support for your mandible, because if you have for example, condylar resorption or idiopathic condylar resorption, if you get a mandibular advancement, that will just relapse. So you need to talk to your surgeon about this. I'm not a surgeon. I do orthodontics, and so it will be important to talk to your doctor about this, and they do specific testing, make sure that your condyles are stable. But the core of the issue is to make sure that you have a stable joint that's going to be able to support your surgical correction. So if you have a stable joint, you should be able to have corrective jaw surgery. But discuss it with your surgeon, and they can do all the testing. Usually, if you have condylar resorption, that's one of the things that we test for. Is they will do testing. For example, they do rheumatological testing. A lot of times they do CAT scans, MRIs, and different blood work just to make sure that your condyles are not actively resorbing. The other thing is, if patients who have actively resorbing condyles, a lot of times they have an ever developing open bite, or more and more class 2 that's developing more and more severely by the weeks and the months. So if you see that, a lot of times that's a sign of condylar resorption. If you have, for example, a functional shift, that's functional shift is when you bite together and your jaw will deviate side to side because of posterior interferences. A lot of times that will create a tension on your condylar disc, and that can create clicking and popping, and uh, you know, condylar issues and pain even. So sometimes when those functional shifts are resolved, then those TMJ problems can clear up in some cases, but not always. But it's very important to correct functional shift and force bite early on at childhood if it's possible. So a lot of times, whether or not you can have corrective jaw surgery will depend on your health of your condyles. So make sure you talk to your surgeon and your orthodontist about the health of your condyles, and make sure they do appropriate testing. If you're getting, especially if you're seeing progressively worsening open bite or worsening class 2, make sure you get tested for condylar resorption, and talk to your surgeon to see what kind of test they recommend before you pursue surgical correction for your class 2 or class 3 problems. I hope this helps you and answer some of your questions, and have a good rest of the day. Bye.